And good morning. It is March 27, 2025. I'm Dr. Deuk. Our patient travels to Deuk Spine because he has two problems: sacroiliac joint pain and piriformis muscle pain. And he has both of these problems. The piriformis muscle has a tear in the middle of the muscle, and it's affecting the sciatic nerve, which comes out around the middle of the muscle and then goes down the leg. So people with a piriformis syndrome can get pain in their lower back. It's usually in the upper buttock, lower back, and then they can get sciatic symptoms or numbness in the leg, weakness, things like that. So we're going to go and do a new type of piriformis muscle release, which is the best treatment for the piriformis syndrome. Now, the traditional ways of doing this piriformis release, the surgeon will make a cut in your buttock about that big, and the surgeon will then cut through the skin, cut through the muscle called the gluteus maximus, medius, minimus, and then they'll see the piriformis way down there. Watch it on YouTube. It's bloody and horrible. And the patients that get this surgery have a big scar in their butt, and they have a sunken in butt because the muscle's atrophied and dead. So I developed at Deuk Spine a brand new way of doing this procedure. It's been patented now. A couple of weeks ago we got the patent. And basically I'm releasing the muscle right here at the top of the trochanter. And it's called the greater trochanter. It's part of the hip. And instead of cutting the muscle in the middle or by the sacrum where it's bloody and dangerous with nerves and blood vessels, right over here there's nothing. It's simple. You can do it with a 4mm incision. That's what we're going to do today. And release the muscle right off the top of the hip. There's no risk of bleeding. There's no risk of nerve injury. There's literally nothing over here. I don't know why anybody else didn't figure it out. So we're going to go in and we're going to get this done. Come on in, Jordan. We use X-ray to find the bone, and that's where the muscle attaches. You can kind of see the muscle too. It's a fan-shaped muscle that runs lateral to medial starting at the greater trochanter. All right, we're going to get our X-ray in position, and I'll show you. You can see the tip of my probe there. I'm going to go down to where the muscle attaches to the greater trochanter. Okay. When you're doing this kind of surgery, you really want to make sure you dock the tip of your probe on the bone. You see exactly where the tip is. That's perfect. That's the top of the greater trochanter. It's called the posterior facet. Yep, and you can actually feel it with your probe. And you should feel it with your probe before you start cutting it, okay? You must feel that spot, and I'm on it right now. It's actually pretty deep. Shot. Yep, I'm on it. So, show us where the muscle is, where it attaches. It attaches right where my tip is, right where the arrow down to the tip. So it's kind of a long attachment, and then it runs up towards the tailbone, okay? So, any questions? Let's show the audience why piriformis hurts and how we treat it at Deuk Spine with the novel state-of-the-art treatment called the Deuk Piriformis Release, which is patented and FDA approved.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk Piriformis Release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk Piriformis Release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Still feel. We're just about done. We're doing the release right now, and it's going well. I can feel a tremendous amount of scarred tendon of the muscle. So he pulled this muscle doing some kind of a bending and twisting. And once you tear the muscle, it's literally impossible. Did you feel it? Yeah. It's literally impossible for the muscle to heal itself. That's the problem. And so what we do is we go in and basically help your body heal it by releasing the scar tissue of the tendon. And you can hear the scar tissue there when I was doing the procedure. It's all done with a little cut, 4 millimeters. It is painful. There's no doubt about it. We lose almost no blood, just a few drops. But the patients always complain about pain deep in the kind of back of the hip there where we do the cutting. So the pain goes away usually in a few days, usually a few days to a few weeks, but it's outpatient and there's virtually no bleeding. There's no need for pain medication either. All right, any questions?
No current questions.
Thanks for joining us. Have a wonderful day. This patient will go home in 30 minutes.